Welcome to another episode of What is going on with my brand new baby. Today I'm discussing 5 wild things about your newborn I bet you didn't know. All right, I feel you. You did your homework, you read that What to Expect book, and now you feel super prepared to bring home this brand new human, right? Like, there's nothing that could happen that would really throw you for a loop. There may be a few things coming your way that you were not expecting that could leave you feeling really frazzled. Like, should I go to the emergency department, or should I call my doctor, or is this a normal sign in my brand new baby? Like, did you know that your baby girl, she might actually have a period, and your baby boy, his privates, they may be quite a bit bigger than you were expecting. And that is because hormones are a major player in the birth experience, right? You have a ton of hormones going through you when you're pregnant, and those hormones, they're passed through to baby. And then when baby is born, they also have this big change and shift in their hormones. I mean, they've just come out into the world and they've had that umbilical cord cut. And while these hormones are adjusting, some things are gonna happen in your baby that might be a little unexpected. So if you open up your baby girl's diaper and you do see a little bit of blood in there, this is basically her first period, and hopefully it's gonna be her last period for at least another decade. But this is a normal thing that happens with baby girls. As long as she doesn't appear to be in any pain, she's not grunting and grimacing, and there is not a lot of blood in the diaper, it is a pretty normal thing to see. And your baby boy, he is not excluded from the hormone party. He is also experiencing some changes of his own, and when he comes out, his testicles, they are going to be very, very swollen from hormones, but also because he's in this fluid-filled womb for like 40 weeks, right? So he's sucking in all this moisture, and that skin of the scrotum is quite swollen. But here is a big tip. Stop talking about how proud you are of your son's big bad gonads. We are not done talking about hormones, because the second thing that might surprise you is the production of breast milk. But not for you, for your baby. There are actually brand new babies that produce breast milk out of their brand new nipples. This is known as witch's milk, but the medical term for it is galactorrhea. It affects around 5% of babies, and it does affect both male babies and female babies, but it is a normal thing to see in your brand new baby, unless it's going on longer than 2 months. If it's gone on longer than 2 months, you should seek medical attention for your baby. Now, what causes this? It's, of course, hormones, specifically your hormones going to baby. It's that estrogen at play here. And what you might notice is your baby's breast tissue is a bit swollen, your baby's nipples are a bit swollen, and they do actually produce a milky white liquid out of their brand new nipples. Now, what you don't want to do is encourage that milk to come out or bother their nipples at all. You want to just leave them be and let it go away all on its own. The next thing on my list, which is far more common than those other 2 things, is that when your baby comes out, they're likely going to have on them this waxy, slippery substance. But fear not, you have not given birth to a block of cheese. You have given birth to your baby covered in something called vernix. And the earlier your baby comes, likely the more vernix that they're going to have on their body, because as your baby gets closer to their due date, they're probably only going to have vernix like in the bends of their arms or their legs, or maybe in the folds of their neck if your baby's a chubby monkey. But vernix is totally normal to see, and it is an incredible substance with a ton of different jobs. It's going to keep your baby safe from infection. It's going to help your baby to regulate their temperature by preventing the loss of water from their skin, and it actually keeps their guts healthy too, because when they're in utero, they are constantly swallowing bits of vernix. And most importantly, vernix is possibly the world's best moisturizer. So if you can leave this on your baby's skin and just rub it in, you are going to notice that they have such soft, smooth skin. And if you could bottle this and put it on your own face, you really should. It is incredible. Now, while that vernix is an incredible moisturizer, you might be surprised to find out that when you take your baby home, that their skin starts to flake. But that is totally normal, because babies are going to shed that outer layer of their skin within the first 1 to 3 weeks of being born. So if your potato starts to flake and peel at home, do not be alarmed. But what can you do about it? You can ensure that they are hydrated by giving them adequate numbers of feedings throughout the day. You want to protect them from the sun. You want to avoid harsh chemicals. Don't overbathe them. And if they are super flaky and peely, you can definitely apply a moisturizer that is safe and non-irritating for your baby's skin. As we make our way down towards the bottom of the list, if you thought hormones were all done, they have one more big kick at the can, and that is in the form of baby acne. But this is going to affect around 20% of babies, and if you do see see it, it's likely going to pop up between weeks 2 and weeks 4. Now, like the acne that we are blessed with, it shows up very much similarly. It's going to look like red or purple raised bumps, or they could have pus in them, and usually they are on their face, their cheeks, their nose, their forehead, but absolutely it could come up on different parts of their body as well. Now, if this is coming up for the first time after 6 weeks of age, or this baby acne is persisting longer than 3 or 4 weeks, then you should seek medical attention or seek out a pediatric dermatologist. If your baby gets baby acne, what can you do about it? You can make sure to clean off their skin at least once a day with lukewarm water, and after feedings, make sure you take off that breast milk residue or that formula residue. Make sure it's nice and clean skin. Avoid really thick, heavy, greasy creams, and very importantly, please do not squeeze these itty bitty pimples. We are not Dr. Pimple Popper. We want to just leave them alone to go away. I saved the best for last because if you see this one, you are for sure going to set off those big bad alarm bells in your head, and you would not be wrong for sounding the alarms, and you would not be wrong for seeking medical attention. But there is a chance when you change your newborn baby's diaper, you might see something that looks like this. And I know, right now, you're sounding the alarms, right? But this is not actually blood. This is something known as brick stains. It is this reddish orangish color you might see in your baby's diaper, and it's caused by something called urate crystals. Now, these urate crystals, they are present in your baby's urine, and when they are present, it means that your baby's urine is very, very concentrated. They are dehydrated. How can you tell the difference between urate crystals and blood? First thing you can do is you can scrape some off and feel it, because the residue left behind by urate crystals, it's going to be a little thinner and a little drier than that of blood. But you can also give it a big old sniff, and it's okay because it's your baby's diaper, so sniff away. But the urate crystals, they're in baby's pee, right? So this would smell like urine, but if it's blood, it's going to smell more metallic and more earthy. Brick stains, they are more common in babies who are breastfed, which makes sense because if you're breastfeeding, then your breast milk, it's going to take a few days to come in, so they are getting less fluid than if you started baby off right on formula. Now, if this is going on longer than 2 to 3 days, or if your baby seems really fussy and in pain with it, or you are concerned, or your baby is not wetting enough diapers for how old they are, then absolutely, please do seek medical attention. If you're concerned at all, you can go ahead and seek medical attention, even if it's a normal thing, because no one would fault you for taking care of your baby. If anything on my list is new news to you, let me know which one down below, or if you have a brand new baby and something threw you for a loop, put that in the comments too so that we can prep all the new parents for what they might be able to expect. If you enjoyed this one, go ahead and give it that thumbs up, boop that subscribe button, and check out this video because there could be a thing or two you didn't know in that one too. Bye.